Do you or someone you know suffer from chronic or acute pain? According to the Canadian Pain Task Force, 1 in 5 Canadians live with pain. Among those living with pain, up to 48% have a substance use disorder. We describe pain as an unpleasant sensory and emotional experience associated with, or resembling that associated with, actual or potential tissue damage. Yet it is known that pain is so much more than a sensory or emotional experience, and it can impact our relationships, work, and your overall quality of life. As a patient with a substance use disorder and a person who wants to take control of their pain, it's important to understand the various treatment options available to you. Today, we're going to talk about a few things. Number 1, what to do if you're experiencing chronic or acute pain and have a substance use disorder. 2, what options and therapies are available to you. 3, what are some barriers or challenges to getting the help you need and how to overcome them. And 4, finally, what can you do on your own to mitigate some of the pain you are experiencing. Let's begin with the first question. If you are experiencing pain, try and get an appointment with a general practitioner or any other specialists, such as a neurologist. Getting a diagnosis and a medical opinion will help begin a healing process to get you back on track to a pain-free life. If you don't have one, finding a family doctor can be difficult. You can call the Healthcare Connect line or go to the College of Physicians and Surgeons of Ontario's website to find a doctor in your area to see if they're accepting new patients. Additionally, you may go to a rapid access addiction medicine clinic or chronic pain clinics provided by the Government of Ontario. The goal in treating acute or chronic pain in patients with substance use disorders are to provide adequate analgesia or pain relief, prevent potential withdrawals, and avoid the triggering of a potential relapse. As such, there are a number of pharmacological and non-pharmacological treatments available to you. Let's first look at the pharmacological approaches. In 2014, a panel of experts published a guide of recommendations in the Journal of Population Health Management for treating pain in patients suffering from addiction. Additionally, the U.S. Department for Health and Human Services published their treatment protocol for managing pain in adults with or recovering from substance use disorders. They noted that a challenge in managing pain for many patients with substance use disorders, particularly prolonged opioid use, is a desensitization or built-up tolerance to effective pain relievers. At the same time, these patients often have an enhanced sensitivity to pain, called hyperalgesia. As a result, experts recommend prescribing non-opioid medications like acetaminophen or Tylenol, non-steroidal anti-inflammatories like aspirin, serotonin norepinephrine reuptake inhibitors like duloxetine, or anticonvulsants like gabapentin or pregabalin. They also suggest that epidural steroid injections may help pain experienced in the lower or mid-back as a result of degenerative disc disease or spinal stenosis, the narrowing of the spine. Additionally recommended is a minimally invasive procedure called radiofrequency neurotomy that uses heat to disturb nerves that are causing pain. In addition to pharmacological approaches to pain management, there are a number of non-pharmacological approaches and practices that have been shown to improve acute and chronic pain management. One such approach is cognitive behavioral therapy. Cognitive behavioral therapy is a psychosocial intervention that aims to improve mental health. It focuses on challenging and changing cognitive distortions and behaviors, improving emotional regulation, and developing personal coping strategies that target solving current problems. A randomized controlled trial studied the effects of cognitive behavioral therapy for helping relieve lower back pain. The participants in the study were divided into 2 groups and had either just 6 sessions of cognitive behavioral therapy or no therapy at all. They found that after a year, the group who had received cognitive behavioral therapy had significantly reduced pain in their back compared to the other group. There are many other studies that have shown similar results for cognitive behavioral therapy and other mindfulness-based approaches for relieving many types of pain, not just in the lower back. Another therapy that is shown to be effective for relieving pain is chiropractic care. Chiropractic care is a non-invasive, hands-on, regulated healthcare profession focused on your spine, muscles, joints, and nervous system. Chiropractors use various treatments depending on their patient's specific needs and preferences, such as manual spinal manipulation, soft tissue therapy, and customized therapeutic exercise programs. Third, what are some barriers to accessing these therapies and treatments? Unfortunately, there are a number of barriers to accessing therapies and treatments to help manage pain for people suffering from substance use disorders. First, stigma about addiction fueled by misinformation and prejudice by healthcare professionals can be a barrier to accessing care. Clinicians or other healthcare professionals may judge that a patient's pain complaint is a drug-seeking behavior. The stigma associated with this idea is an obstacle to manage pain for patients. Another barrier to accessing care is the financial burden of many pharmaceutical and non-pharmaceutical therapies that can be used to manage pain. For example, some therapies like cognitive behavioral therapy are not covered by OHIP or assistance programs like Ontario Works or Ontario Disability Support Program. This can limit the access to quality pain management tools for many people who do not have private insurance. However, there are therapies that are covered by assistance programs such as chiropractic care or physiotherapy. Patients with substance use disorders managing pain may also be asked to have more frequent visits to their healthcare providers to continually monitor their condition. They may also be asked to provide urine samples and create a plan for a possible relapse. Finally, this brings us to what you can do now to begin a road to a pain-free life. One thing that you can do that has proven to help reduce pain is staying physically active within your abilities. A study of over 19,000 patients found that exercise ranging from yoga, Pilates, to strength training helped relieve pain. However, it's important not to overdo it and to listen to your body. Another strategy to try at home is meditation. Many guided or mindfulness meditation resources are available for free on YouTube or in apps for smartphones and tablets, like Headspace or Calm. Meditation has been shown to effectively reduce many types of pain for a wide range of people and sometimes as little as 8 weeks of practice. We hope that this video was informative to give you the tools and knowledge to begin the journey to a pain-free life. Thank you.